Welcome to this podcast series on aortic dissection. My name is Roy Sheppard, and I'm joined by Edward Montgomery, who we're going to be calling Monty, because it's all his mates do. We've got Martin Hilton and Bejal Pandya. Now, Monty and Martin have both experienced aortic dissection, and Bejal is a consultant congenital cardiologist at the Barts Heart Centre in London and has substantial experience and expertise in dealing with aortic dissection. And in fact, just now, before we started, she said, I've had 2 this week. So today we're going to focus on the recovery from aortic dissection. So Bejal, if we can start with you, you can give us a bit of an overview, I hope. What are the key stages of recovery?
Thank you, Roy. And I would say that the key stages of recovery are in the preliminary phase when you're an inpatient. You might be recovering from an operation. So it's going to be de-intensifying from the procedure initially. So, you know, most patients will wake up from a dissection operation having lots of drains in their body, maybe have lots of lines in, catheters in. So the first stages of recovery, I think, are that hospitalized stage. And that can be anything up to a week to 10 days to recover from the acute surgery for dissection.
So that's the physiology of having had an operation?
Yeah. It depends also on what type of dissection you have. So if your dissection is the ascending part of the aorta, that's an emergency operation. If it's a descending part of the aorta, it often doesn't involve surgery and just involves being hospitalized, being very closely monitored, and being on medication to control your blood pressure. So it depends on what type of dissection you have. But I think that hospitalization is the first phase. And I think for a lot of patients, you know, certainly who are not used to being hospitalized, that environment can be quite intimidating. It can be quite, you know, you don't get much sleep, you've got beeps all night, you've got nurses coming to monitor you, you've got doctors doing ward rounds, you've got medical students coming to see you. So it can be quite an unusual environment to be in. So that, I think the first phase of recovery is the hospitalization and then recovering from that experience, if you like, which I think a lot of patients do find daunting and unnerving. And then you've got the second phase, I would say, which is the rehabilitation phase, where you're then allowed to go home, but you have to compensate for a change in your lifestyle quite often. And that would be...
What sort of period are we talking about? You've got hospitalization for maybe up to a week, and then you're given the option then to go home?
Yeah. So when you're medically fit, you'll be discharged from hospital. But then there's a recovery phase that you have to do at home for yourself. And that's the rehabilitation phase, recovery phase, I guess. And it's learning to accept what's happened to your body, but also learning to live with the fact that you've had a dissection and modifying your lifestyle to make sure that you're optimizing your welfare as well as recovering. And in a lot of patients that I see with dissection, that means that affects your exercise, that affects your blood pressure control, it can affect your mental health, it can affect your family members around you. So, yeah, it's quite a different... I think that phase is probably the longer phase of recovery.
What about medication alongside all of this?
Yeah, so the medications mainly used are those to optimize your blood pressure control, because we know that dissection is often related to a high blood pressure or changes in blood pressure or acute release in hormones such as adrenaline. So the medication is targeted to lowering the blood pressure, and we try and aim for a blood pressure less than 120 systolic over 80 diastolic in most patients.
Unless we're getting it back to normal then.
Yeah. But in patients who are predisposed to dissection, who have connective tissue diseases, like those with Marfan syndrome, I aim to get their systolic blood pressure less than 100, so quite low.
Why?
Well, the guidelines from the European Society of Cardiology and the American Health American Heart Association, suggests that actually running a much lower blood pressure reduces tension on the wall of the aorta.
Okay, so that's stabilizing the patient, getting them into the optimum position to be able to start a process of becoming physically fitter. What is the process there?
So historically, patients were advised to not exercise and and not be proactive in their healthcare after dissection. But actually, we now know that exercise is very good for you post-dissection within limits. So the exercises that are recommended are those that are aerobic, essentially. So cycling, running, walking are all good things. The exercise to avoid...
Swimming seems to be an exercise that is low impact, but can actually have the same effect.
Indeed, swimming is great. So the exercises we're aiming for are those that increase your heart rate, but don't increase your blood pressure so much. So the exercises to avoid are those that are static exercises, and they're the exercises whereby you are sustaining a muscle contraction for a long period of time, or putting a muscle under high stress, such as heavy weight training. And those exercises, such as if you're lifting like a deadlift, for example, those exercises mean that your muscles contracted under high strain for a long period of time. And what happens is your body physiologically then increases the blood pressure to get oxygen to that muscle. And we know that high increase in blood pressure is quite bad for you. There's been some experiments done in weightlifters, and they measured the blood pressure in the carotid artery when they were doing deadlifts of over 100 kilos. And their systolic blood pressures were in the region of 400 to 500 millimeters of mercury. Yeah. So that's not a good pressure to have against your aortic wall, especially if you're post-dissection. And so exercises that involve lower weight load but high repetitions are preferred, hence the aerobic type exercises.
All right, look, we're going to come back to you in a minute, but both Martin and Monty have been listening attentively to that. Monty, how well did Bejal just describe your personal experiences after you'd been hospitalized?
It was interesting. In particular, when I had my aortic dissection, which was in October 2022, I was actually in the gym doing weights. So, and I was a young, 40-year-old exec, very fit in theory. I don't drink, but I was basically on a sort of a 12-week program doing weights, and I had an emergency procedure. I can't remember it actually, but I was conscious on the way through. But yeah, they thought I was having a heart attack, and then I wasn't, and I was very lucky to be alive. I got rushed to the hospital at St Thomas's in London. And so just to talk about, the weights and the high blood pressure was obviously a key effect. I mean, I do have issues, an emergency, but yeah, that resonated. And obviously everyone says do weights, but I think that high blood pressure, and also I think the recovery, they do talk about doing a lot of warm-up, which I never did. I used to go straight to the gym, have a coffee, and straight into the weights, which is just a recipe for disaster.
So basically a type A personality, you want to do it straight away, get on with it. So let's just talk about how you had to change in terms of your attitude and behavior during the recovery period.
I suppose on the physical side of things, as Bejal rightly said, there is a process when you're in the hospital. And I've actually gone through an aortic dissection, and then I had to go back last year to have another open heart surgery because they had complications. So I had to do it again, so twice, which was
lucky you.
Which is, but I did learn a huge amount from the first one. I mean, I didn't even know what an aortic dissection was, right? So I woke up with amnesia for sort of 2.5 days, and I woke up, as Bejal said, in a hospital 24 stitches down my chest, six tubes in my neck. I was on oxygen because my lung collapsed as well. I also they took out 26 stitches in my leg because they thought I was having a heart attack. So they took out a vein. So the emotional and physical recovery, I had to basically, my mindset and also my physical recovery took a while to get around, really.
And
But
I guess that because yours was an emergency and you didn't even know what an aortic dissection was, all of this was completely unprepared. You had no idea, what was happening and what would happen during your recovery.
Yeah, correct. And I think it's probably, the biggest thing that's ever happened. Obviously, I just woke up one day and exec with the young family, and then I was in hospital, and I wouldn't say whole life changed, but it did, a massive change of what I had to do. So in terms of the physical recovery, I think it was one of those stages where my mind and body were totally out of whack for a while. And it's when I sort of realized how amazing the body is in terms of recovery. It does recover very quickly. But I mean, Martin will talk, but I actually struggled mentally with it. I was really sort of quite not depressed, but also angry that this had happened in a way.
You're angry that you survived.
I know that sounds weird, but yeah, I was angry that this had happened. A young guy, fit. It was like, sort of, why me? So that's my lesson, which I did take into the second operation. I accepted it, but I think the lesson really is that, as you say, Bejal, that if you're in hospital, I think you need to let the drugs and everything recover. But then there's a period where you really have to push yourself and start moving and getting out there. And I think if I'd done more of that at the first time round, I would have recovered quicker. And the second time round, I recovered really quickly because I was fit. I was doing yoga. I think really getting out of bed each day, 3 times a day when you're in hospital, moving, your recovery and your mental state will improve materially.
So, Martin, what were your experiences? Because you're also a highly active person, an Ironman indeed. So, what happened to you, and how did you go on the route to a recovery?
So, very similar to Ed, actually, very similar to Monty. And we don't want to put people off exercise, but I was also exercising when I had my aortic dissection. But I wasn't weightlifting. I was just out running, and I was under no stress or pressure. So it was just a really strange incident. And that happened. And that was a type A. That was emergency. And then obviously you go into the surgery, and you come out of the surgery, and my overriding feeling and emotion was just, thank God to be alive, and that joyfulness that you get from having gone through that. I mean, I went into the surgery, although it was a short time from what happened to going into surgery. I went in with a positive mindset straight away. I was going to, get through this, and it was all going to be okay. So I prepared myself pretty mentally for the surgery in the short time I had, which was pretty good. But then I think, Bejal talks about it brilliantly. All the tubes, I was just amazed, so I felt
were
like
you intimidated by it, or were you bemused, or what? Was
strange. It was just a really strange situation, really, not one that you kind of woke up that day thinking you were going to be in later on. So, but to be honest, I think my initial motivation completely and mindset was just right. Let's get on the road to recovery, and just do everything. And again, a little bit like Ed, I tend to sort of challenge myself quite a lot. So like you say, I was an Ironman before dissection. So back in 2019, I did my Ironman. Before that, I was doing marathons, half marathons, mountain marathons, long swims. So I was really, really, really fit. So I suppose there was a bit of me that goes, well, how the hell has this happened? When I was at sort of a peak level of fitness. But my overriding motivation in recovery was just to get fit again. And I know I think the second sentence to my surgeon, the wonderful Mr. Mehta, was, will I be able to do triathlon again? So, and it was a funny mentality because that was important for me. But also, if it had been told no, I probably would have accepted it because, I was alive and so grateful for that. But Mr. Mehta said straight away, yeah, you will be able to do that, but it's going to take time and you're going to have to adapt. And I think what Bejal was saying earlier about just adapting the mindset, I did a half marathon 2 weeks ago, and it's easy in my mind to go, that's my personal worst time. Because it was my slowest time. I used to do 1:40 half marathons. The other week I did one in 2:30, but it's my fastest since aortic dissection. So I count it as a new PB. So it's that mindset that you're playing all the time, really. But my goal really, as soon as I could, I wanted to get out of bed and get going, and I was given a piece of apparatus because I again suffered or experienced a lung collapse. So I had this spirometer, and that was my goal, this spirometer where Bejal will probably explain better, but it's like a plastic tube that you suck out of, and it lifts a float in this piece of equipment, which builds up your lung capacity again. So my goal every day was to try and lift this float just that little bit higher every day.
So Bejal, how do you deal with patients who are different to these ultra fit type A personalities? Because aortic dissection doesn't just affect these sorts of guys.
Yeah. So I've looked after many patients with dissection over the years, and just say that dissection doesn't really occur in the pediatric population, but I've looked after patients who are teenagers with dissection all the way through to patients who are in the 80s and 90s. Majority of dissections occur in the older population because the number one cause of dissection is aging, and risk factors such as smoking, high cholesterol, high blood pressure, all those things that are lifestyle factors that you can modify. So the majority of patients are those patients who are in their 70s and 80s with dissection. And yes, certainly the first thing to do is modify those risk factors. So stopping smoking, getting cholesterol under control, treating diabetes, they're the first things that I would recommend to a patient to change their lifestyle.
And I would imagine that if you're an older man in this particular case, they're more likely to listen and actually do something about it. Whereas the guys that we've got here are self-motivated and might struggle to listen because their entire life has been about physical exercise and perversely being healthy.
Yeah. So in the sedentary population, it's trying to actually motivate them to become more physically active, bizarrely, and modify their lifestyles to take on a lifestyle like Martin and Monty have. And I think I do have patients like Martin and Monty who are very physically active, and it's really interesting to hear that Monty was actually at the gym lifting heavy weights when his dissection occurred. And with all of my patients with dissection, I always ask them, what were you doing at the time it happened? And you're not the first patient I've come across, Monty, who's actually had dissection whilst lifting heavy weights. Yeah. I've had patients who've been like on roller coasters when it's happened. I've had patients who, adrenaline junkie type people who enjoy the thrill having a dissection. But I think the main thing is that in the recovery phase of dissection is doing safe activity, and it's the safety aspect of it. And we measure exercise by something called metabolic units, or METs. And there's very good guidelines, not just guidelines, but there's good evidence to show that activity that's sort of around 5 to 10 METs a day is what you should be aiming for. And that means things like gentle jogging, hiking type things. But there's METs that even calculate how much you're using as a unit when you're doing hoovering around the house. So, any sort of physical activity is good. So avoiding that sedentary lifestyle, just sitting on a sofa and watching TV and Netflix series one after another, is the thing to avoid.
All right. In terms of anybody who does physical fitness, you know that if you take a break from it, you lose it very, very quickly.
Yeah.
So, Monty, what did you notice about the change of your fitness levels as you embarked on your recovery?
Well, one thing I noticed that, it was a slow recovery. And then the doctor said, walk. And my mindset was, that was the first thing to do. So I did listen to them. And I think when I came out and Martin said he was euphoric and I was a bit more grumpy, I did have a laugh at myself when I was walking my kids to school and I'm walking and puffing really. And I was like, okay, this is the road to recovery. But when I look back from being on the couch to walking, I would just say, you just got to start slowly but do it is what I would say. And also I think it took me probably a year to really get back into it, but then I've become a bit of a yogi junkie. I would never have done that before. Now I do yoga, flowing type yoga. I swim a lot. I used to do a lot of not a lot. I did 5 marathons, but I was never a great runner, but I used to run a lot. I don't run so much now, but I did like a month ago. From lying on my bed, I climbed Bed Nevis with my daughter, which was for me a big thing. So I have adjusted. I probably do more regular exercise now than I've ever done before, but I've adjusted. And I don't, like Martin, I don't have to run a marathon and get, under 4 hours. But my advice would be, create your own health story and enjoy some stuff that you want to do and find something that you enjoy and then just keep doing it and maybe mix it up a bit. I'd also probably advise, I don't drink, but I think you probably know some things health-wise which you're not doing well: overeating, smoking, non-drinking. I mean, someone I advise to have a look at is Andy Ramage, who's a guy who's helped me with, I don't drink, but he's someone to look at. So just look at these type of things and make some adjustments. And then when you make the adjustments there, what I would say, there's a real recovery story and you can lead a really productive life is what I would say.
Martin, how did you adjust your fitness behavior? So in terms of what Bejal was saying about having safe recovery and safe exercise, was there a big adjustment required for that? Because you're now saying that you're back to doing the intense stuff.
And yeah, well, it was still a long recovery to get there. So, the way Bejal describes it is absolutely what happened with me, because, and the way Monty there talks about slow walking, it's almost inevitable to start with that's what you'll start with, because I was amazed actually a week in hospital. In fact, I don't think I was even in a week, because my dissection was literally a week before the first lockdown. So it wasn't a very smart time to have it. So I wasn't in hospital very long. But then walking was kind of like, I would walk every day with my family. We were all locked down. But it was painfully slow. I mean, it was embarrassingly slow. So
only to you, though, not to anybody else.
Well, yes, absolutely.
Just recovering from an emergency.
I know. But in a way, it was good, I guess, because my mindset would have been wanting to go out and probably start running and getting on my bike and pushing things, but physically I just simply couldn't. I mean, the way you waste away in such a short space of time is just incredible. So my wife used to joke, that I'd lost my legs had gone all skinny and I'd lost loads of muscles. So all that has to come back, and at the same time, you're on a lot of medication, which kind of initially works against you trying to get fit, I suppose. And so I spent quite a lot of time, and I was very lucky. I had, as part of my fitness recovery, I had cardiac rehab. So, and went to see the team there. They were brilliant and gave me more confidence, actually. So one of the nurses I was working with there got me on a running machine, and obviously had me measured up, and had heart monitors on and things like that. But she was saying, why? Because I'd explained to her, look, I want to get fit. I want to get back to fitness, and I'm frustrated because I can't get upstairs, I can't walk properly, I can't run properly. And she actually got me running and saying, what's stopping you, you know? And it was actually myself that was stopping myself. She said, look, you're fine, start running. And there was a little bit of a mental block there, I think, because you've just had this thing repaired inside of you, which I've kind of likened it in a way to almost having a puncture repair kit, you know? And from when we used to repair punctures when I was a kid, you know, oftentimes if you pumped it up too hard, afterwards the thing had come off again. So in my crazy mindset, I thought, crikey, if I push myself too hard on the fitness, am I at risk of blowing things up again? So, I was cautious.
The next episode is going to be about the psychological effects of aortic dissection.
Yeah.
I'd ask you to think about what are the bits of advice that you'd give. So, Monty, if I can come to you, how would you summarize the learnings that you got during your recovery, and what advice would you give?
Well, the advice on this episode, sort of on the physical recovery, is I would say, sort of, don't let your health issues become your story. Is one sort of way I would say it. Like, create your own story. Like, just because I had aortic dissection didn't mean my life stopped or whatever. I mean, so I had to sort of, I'm talking quite openly here, but I don't really talk about it too much unless people ask me or my family. So I just sort of say, right, you know, this has happened. And I would say, I talk about it in the other episodes, but, you know, fall in love with reality. The quicker you accept this, and I did take my first time, I took a long time to accept it. But that would be my advice, you know, be curious, understand it, and own it in a way. And then I would say make adjustments. So I've had to make adjustments with my physical recovery in terms of what I could do, what I can't do. So I'm not going to be going back to the gym doing weights, but I'll do, you know, swimming, yoga. I'll start to run a bit more, and I could do the hiking. So I would say make sure you find a routine that works. And also, Martin mentioned the rehab, which is really good for me. I think one thing I learned from that was you do exercise where you can talk, so that you know, you can always talk during, you know, you can build up your breath, but you can basically still talk. So that's sort of a level which they always said just get to and then stop. So you can still do a half marathon, but you're probably not going to be doing really, really hard ones. I know Martin probably doesn't want to hear that, but I mean, he knows that.
Yeah.
And then, you know, I suppose I've also, you know, mentally, I've had a stroke also as well. So there's a bit of, we haven't really gone into that, but I think you know, allow your body, you know, mentally that was that, but also physically allow it to do its thing. And then, especially when you're in hospital or recovering in the first initial stage, allow your body to do that and rest. But then I think, you know, then it's up to you and your friends and your doctors to start gradually moving things forward.
All right, Martin, what advice would you give? And I'll get Bejal to give us a summary of maybe the do's and don'ts to bring this to a close. But Martin.
So I'd back up everything that Monty says, really. So having that mindset is really important. Accepting the reality, which is the phrase that Monty uses, I think is a great one, because there's a temptation to sort of beat yourself up a bit. And I was doing that myself. So when I did get back to running, and I was running at kind of 11-minute mile pace instead of 7.5-minute mile pace, of course you get frustrated because you're now performing a lot worse. But so I had to sort of treat myself, and this is one of my top tips, I think. Treat myself like a good friend. You know, what would I say to my friend who had experienced what I had? And so I'd suggest that. So, you know, be kind to yourself, but do keep challenging yourself. And like Ed says, you know, don't be defined by the illness. You know, you can achieve amazing things. And I think probably the best thing I think I eventually learned to do really well was work with the medical professionals who are absolutely wonderful. work with them, explain what you want to achieve. They will help you achieve it. You can still achieve great things, and even reducing drugs and the medications. I managed to get off most of the medications, which again help my fitness. So I think it's about taking responsibility. The medical profession will be brilliant at keeping you safe and sound, but unless you tell them, well, I want to achieve a bit more and I want to do this, that, and the other, they can't sort of tailor things for you. So I don't know how Bejal feels about that, but that's what I tended to do, and got my pacemaker settings changed, so that helped me, and all sorts of bits and pieces to get myself fit and to go on and achieve a second Ironman, albeit a half Ironman this time. So,
all right. Well, if I can turn now to an amazing medical professional to bring this to a close. But before we talk about the do's and don'ts, just picking up on something Martin just said there about treating yourself as a friend and mentioning family. What advice would you give to family members, Bejal?
So I think if you've got a syndromic cause for your dissection, then I think all family members need to be screened. Firstly.
What does that mean? It's a genetic...
Yeah, so some people are genetically predisposed to aortic dissection, and they have something called connective tissue disease, for example, which makes the wall of the aorta weaker. So I think if you're one of those people, then all your first degree relatives should be screened for the same genetic defect, so that you can then be under regular surveillance, and you can undergo elective surgery prior to dissection, so you don't actually have the dissection. So it's a much more controlled thing, and therefore your long-term prognosis is much more improved. But I think in a spontaneous dissection, as in both Martin and Monty have had, I think for family members it's really difficult. I think you need to be patient for the recovery period, understand this person who's been very dynamic and proactive is psychologically going to have a big burden to deal with, because I think it's a really life-changing moment, right? There's been some good data showing that patients who've undergone dissection, it affects their relationships with their spouses. So intimacy can often be affected. Relationships with children is affected. When you've had a dissection, if you're a young person and you've got young children, you want to pick them up, throw them around, you can't do that so readily. So family have to be quite understanding of the changes that people have to make having had a dissection.
All right. Sorry.
I was going back to about the recovery period, and we're talking about when Martin was talking about how his muscles were wasting away. It's really interesting because when you are a very physically active person, your heart adapts to that, like any muscle in the body. The heart becomes the muscle wall becomes much thicker, and much more, the contractile function of the heart improves a lot. And we do see that within very, very fit athletic people, when they stop exercising, within 6 weeks, roughly, the heart muscle starts shrinking back, as with any other muscle in the body. So the muscles waste within the heart as well. And so it takes approximately 6 months of intensive exercise to get back that muscle strength that you've lost within 6 weeks within the heart itself.
Yeah, that makes sense.
So I think that sort of message about having, when you're sort of bedbound and more sedentary after having a major event like a dissection, it's, your body does the atrophy. The medical word is atrophy. So the muscle does atrophy, which means it reduces in size. But it takes much, much longer to build it back up again. And I think patients need to be aware that phase of building things back up to where they were is nowhere near the time it takes to decompensate.
All right. I mean, as a man who is closer to 70 than 60, I was told that there's natural aging, muscle wastage and atrophy anyway. So I was told years ago, build your muscle now, because if you ever lose it, you have to have it in the first place. If you could summarize the do's and don'ts of recovery for everyone, whether you're a fit guy or a not so fit guy, what would you alert people to, and to keep them having this at top of mind?
So let's start with the don'ts. So the don'ts are all the things that predispose you to further problems. And as Monty mentioned about stroke, so dissection is not just the aorta, it's a cardiovascular problem, it's a vascular problem, and the vessels involved, not just the aorta, but vessels in your legs, vessels in your arms, vessels in your brain. So modifying things like not smoking, getting the cholesterol under control, blood pressure under control, diabetes under control, they're really important. We now know, we have better understanding on other things as well, such as, you know, high anxiety, stress levels can contribute to that. I have seen many patients who use too much cocaine. I'm not saying that Martin or Monty in their executive roles use that, but yes, I have a number of patients who are journalists or executives that use cocaine. So stop doing those things that can affect the wall of the aorta. But I would recommend the do's are seek medical help early. Get advice on exercise and safe exercise to rebuild the muscle strength and rebuild your body back. Seek help for mental health issues, which are very commonly associated. And then, as Martin was talking about medical therapy as well, there are medications that we often use to control things like blood pressure and for secondary prevention, such as beta blockers. They do make you feel tired, they make you feel lethargic. You know, they're often associated with erectile dysfunction, nightmares, so, talk to your medical professional about the right drugs for you going forward as well.
Okay, well, that's where we have to bring it to a close. Can I thank both Martin and Monty for contributing their own personal experiences here? And obviously, Bejal, thank you so much for giving us a medical overview of this. It's been a pleasure to talk to all of you. Our next episode is going to be about the psychological effects of overcoming aortic dissection. So for now, thank you very much.
Thank you.
Thank you very much, Roy.
Thank you.